In this PowerPoint, we are going to focus few question and answer about antepartum care. So this question basically contain few information what is important for NCLEX every student must know. Question number 1. A 30 years old primiparous client, and she is 38 weeks gestation and come to the prenatal facilities and concerned about the reddish stick, and she has a increasingly developed on her breast and abdomen. And she asks what this skin change are and whether they are permanent or not. And what should the nurse tell her? So your patient is primiparous, 38 weeks of pregnancy, and she has some thin marks and came to you and asking, is it permanent or not? So number 1, what should be your response? And these sticks are called linea nigra, and they will fade after the childbirth. So number 2, and these sticks are called hemangiomas, and they are permanent and permanently change of pregnancy. And number 3, these sticks are called strigravidarum or stretch mark. They will go away or they will grow lighter after the delivery. Number 4, and these sticks are called nevi, and they will fade after the postpartum period. Before to go correct answer, I want to read this question one more time. Why I want to read? Because these examiner do not give any picture. You have to understand the examiner mind, read this question. What is she is asking? Is it linea nigra or is it strigravidarum? So concerned, your patient is concerned about the reddish sticks, and she has increasingly developed on her breast and abdomen. But linea nigra usually one, not several. But you say this is the sticks, plural, more than one. Also breast and abdomen. But linea nigra in the midline along the umbilicus. So number 1 is not an answer. During the pregnancy, few of the intragumentary change, and this is normal. And after delivery, it will be disappear. The correct answer is number 3. These sticks are called strigravidarum or stretch marks. They will grow lighter after the birth. So in this picture, we can see this is strigravidarum, but this only one along the midline through the umbilicus, this one linea nigra, right? Both will disappear, both will grow lighter after the birth. So rationale, the client weight gain and enlarging uterus, combined with the action of adenocorticosteroid, they lead to stretching of the underlying connective tissue of the skin, or creating strigravidarum in the second and third trimesters, better known as a stretch marks. And these streaks develop most often in skin covering the breast, abdomen, buttock, and thigh. After delivery, they typically grow lighter, and linea nigra is a dark line that is extend from umbilicus and above to the mons pubis. In the primigravida, the line develops at approximately third month of pregnancy. In the multigravida, multigravida clients, linea nigra typically appears before third month. And tiny bright hemangioma may occur during the pregnancy as a result of estrogen release, and they are called vascular spiders because of branching pattern. Next question. Before to go next question, I want to show you few of the changes during the pregnancies we call probable sign. So like uterus should be enlarged, bigger in size because of fetus. Usually uterine enlargement occurred irregularly at the beginning and uterus above the pubic symphysis by 12 weeks of pregnancy. And it reached umbilicus by 20 to 22 weeks. Also, 3 signs should be positive. We call Heger sign, Gurel sign, and Chadwick sign. So Heger sign means softening the lower uterine segment, and it is occurred the second to third month of pregnancies. Heger sign, we said. So in this picture, examiner feeling the cervix, right? And Goodwill sign means softening the cervix and vagina, both. Softening cervix, known as Goodwill sign. And Chadwick sign means blue and purple discoloration of the cervix, vagina, and vulva, like this picture. So also in this picture, we can see vaginal mucosa becomes congested, right? Blue and purple in color here. Also ballotment. What is ballotment? Rebounding of fetus. Again, examiner finger and examiner can palpate it. Braxton Hicks contraction. It is the irregular, painless contraction throughout the pregnancy. Abdominal enlargement, more rapid after 12 weeks when uterus raises into abdominal cavity. And abdominal stretch marks. Skin pigmentation change like hormonal change occur, nipple may darken, linea nigra, brown or pink line from umbilicus to pubic symphysis. like this, okay, along umbilicus to pubic symphysis and stay gravidarum, right? So here showing in a short, goodwill sign means softening cervix, Chadwick sign, blue color, cervix and vagina. Hagar sign, softening the lower uterine segment. Also normal abdomen should be enlarged, pigmentation and stretch mark. Ballotment, a method of diagnosis the pregnancy in which the uterus is pushed with a finger to feel whether the fetus moves away and return again. Also positive pregnancy test and palpation of the fetal outline. What next? A nurse is planning care for a 16 years old adolescent in the prenatal clinic. Adolescents are prone to which complication during the pregnancy? So adolescents are 16 years girl getting pregnant. So if adolescents got pregnancy, what are the common complications during the pregnancy? Number one, iron deficiency anemia, varicosities, nausea and vomiting, and gestational diabetes. Nausea and vomiting is a common normal sign of pregnancies. It is not a complication unless it would be too excessive, what we call hyperemesis gravidarum. So what is the correct answer? Correct answer is iron deficiency anemia. So iron deficiency anemia is a common type of anemia, a condition in which the blood lack of adequate healthy red blood cell, and red blood cell carry oxygen to the tissues, right? So if you read the name iron deficiency anemia, so the name reflect the cause. Anemia due to the insufficient iron. So what are the rationale? Iron deficiency anemia is a common complication of adolescent pregnancies. Adolescent girl may already be anemic. The need for iron during pregnancy for fetal growth and increase the blood supply compound the anemia even further. Varicosities are a complication of pregnancy more likely seen in women older than age 35. An adolescent's pregnancy does not increase the risk of nausea and vomiting or gestational diabetics. So what are the common signs and symptoms of iron deficiency anemias? Patient complain fatigue and tiredness because your tissue do not get enough oxygen. Lack of oxygen, lack of metabolism, lack of energy, shortness of breath because your heart work too much, need more oxygen. Patient feel depressed, hair loss, restless leg syndrome, frequent headache, increased sensitivity to cold, and return need. Next question. A client is 38 weeks of her first pregnancy. She calls the prenatal facility to report occasional tightening sensation in the lower abdomen and pressure on the bladder from the fetus. 38 weeks of pregnancy, which she say seem lower than usual. And the nurse should take which action? Number one, review pre-monitoring sign of labor with the client. Nothing abnormal, it is possible. Number two, instruct the client to go to the healthcare facility for a non-stress test. So patient came to you, you have to give some solution, right? Number three, ask the client to bring in a urine specimen for urinalysis. You do not need urinalysis now. Number four, make an appointment for the client to see physician immediately. So correct answer say, the nurse should review pre-monitoring sign of the labor, right? Because patient is already 38 weeks of pregnancy. We have to evaluate. Rationale, because the client is describing the two pre-monitoring sign of labor. One is Braxton Hicks contraction and tightening. The nurse should review these normal signs and reassurance the client. And NST used to assess the fetal well-being and would be inappropriate unless the client reported changes in fetal activities. Urinalysis would not be indicated unless the client reported symptoms of bladder inflammation, such as dysuria or urinary frequency or urgencies. Because the client findings are normal, she need not to see the physician other than at her regular weekly appointment. Next question. A client is scheduled for amniocentesis. When preparing her for the procedure, the nurse should do ask the client to void, instruct the client to drink 1 liter of fluid. Number three, prepare the client for IV anesthesia. And number four, place the client on her left side. So the client schedule for amniocentesis. So amniocentesis, a procedure performed during pregnancy to obtain amniotic fluid, right? Amniotic fluid we obtain to test for chromosomal abnormalities and fetal infection, right? So what is the correct answer? Before amniocentesis, we request mother to void the urine, right? So in this picture, amniocentesis procedure, this is the baby uterus, and this is ultrasound transducer. So sometimes we can collect that fluid, amniotic fluid raw with a needle under ultrasound guided. So it is very important to be do carefully. Rationale say, to prepare a client for amniocentesis, the nurse should ask her to empty her bladder and to reduce the risk for bladder perforation. Before transabdominal ultrasound, the nurse may instruct the client to drink 1 liter of fluid to fill the bladder. IV anesthesia is not given for amniocentesis. The client should be supine during the procedure. Afterward, she should be placed on her left side to avoid supine hypotension syndrome. Also promote the venous return. Ensure adequate cardiac output. Right? In these pages, we are going to little bit more discussion. So amniocentesis is a diagnostic genetic testing offered to pregnant women with a high risk of having a child with genetic abnormalities and those with positive scanning test. So amniocentesis test result help to detect any chromosomal abnormalities like Down syndrome, like spina bifida, right? So we collect the amniotic fluid or amniotic fluid sampling. So what are the duration we do this? Usually 10 to 15 minutes we do. So what is the purpose? Diagnostic genetic disorder and neural tube defect, including Down syndrome, sickle cell anemia, spina bifida, and cystic fibrosis. The procedure consists withdrawing a small sample of amniotic fluid from the uterus with a long, thin needle guided by ultrasound. It is usually outpatient procedure, take 15 to 60 minutes. Some books say take usually 10 to 15 minutes. And risks and complication through generally safe and it is invasive procedure, but very uncommon risks and complication include. So what are the complications, if any? Sometimes miscarriage, amniotic fluid leakage, infection, and injury to the baby. Result can take from 3 days to up to 4 weeks. Positive results are 98 to 99% effective for test condition. And ability to roll out condition is high, and ability to confirm condition also high. Next question. A nurse is caring for a client after evacuation of hydatidiform mole. The nurse should tell the women about what? So hydatidiform mole, a type of trophoblastic tumor. Other hydatidiform mole, also called molar pregnancy, right? Molar pregnancy means it is an abnormal form of pregnancy in which a non-viable fertilized egg implanted in uterus and will fail to come to the full term. A molar pregnancy or hydatidiform mole is a gestational trophoblastic disease. and which grows into a mass in uterus, right? So the nurse should tell women about what? Number one, wait 1 month before trying to become pregnant again. Number two, make an appointment for follow-up human chorionic gonadotropin level monitoring at the end of 1 year. Number four, discuss options for sterilizations with physician. Number four, use the birth control for at least 1 year. So correct answer is, tell your patient, use birth control for at least 1 year. Request them not to be get pregnant at least 1 year. So in this picture, we can see the uterus is full of grapes-like cluster. It is called molar pregnancy, or it is called hydatidiform mole. It is trophoblastic disease, right? And that has swollen chorionic villus. So rational said, after experiencing a molar pregnancy or hydatidiform mole, the client should be counseled to use a reliable method not to get pregnant, or use the birth control for at least 1 year. Because of the risks of choriocarcinoma, or HCG, human choriogonadotropin hormone level need to monitor monthly for 1 to 2 years. If HCG level remain low, a mother may try to become pregnant after a year. The risk of recurrence of a hydatidiform mole is low. Sterilization is not necessary after a hydatidiform mole. Next question. A client treated with a medication, it is called terbutaline, right? Terbutaline for premature labor is ready for discharge. Which instruction should the nurse include in discharge teaching plan? So terbutaline, right? It is the medication we use for like asthma, or we use for wheezing and shortness of breath from lung problems like asthma, chronic obstructive pulmonary disease or COPD, bronchitis, or emphysema. And this medication we also can use in maternity, right? So if we use the terbutaline for premature labor, is ready for discharge, which instruction should the nurse include in discharge teaching plan? So we have to know what are the terbutaline interaction and effect, right? So report a heart rate if greater than 120 beats per minute. It is important to inform physician. Take the terbutaline every 4 hours during working hours only. Number three, call physician if the fetus move 10 times in an hour. Number four, increase activity daily if not fatigued? The correct answer is report a heart rate greater than 120 beats per minute to physician. So tarbutaline, rationale, because the tarbutaline can cause tachycardia. The women should taught to monitor her radial pulse and call to the physician for a heart rate greater than 120 beats per minute. Tarbutaline must be taken every 4 to 6 hours around the clock to maintain an effective serum level, and that will suppress the level. A fetus normally moves 10 to 20 times per hour. The client does not need to control the physician if such movement occurs. The client experiencing premature labor must maintain the bed rest at home. So in this table, showing few important medication, what we should use during pregnancy and what we do not use during pregnancies. Like first one is pitone. Other name is called oxytocin. Pitone basically we use for labor induction or postpartum hemorrhage. So if your patient need to take, always we have to monitor for side effect like hyponatremia, painful contraction, and pitone is contraindicated if uterine hypertonicity. If the contraction is more than 90, right, beat more than 2 minutes. When we should discontinue the pitone, like sustained uterine contraction, if the fetal discoloration or decreased urine output, it is good to stop. Other medication that we few minutes ago we saw the question, tarbutaline. Tarbutaline we use for asthma or COPD, premature labor, and we given until 37 weeks for lung maturities, right? When lung maturity is there, we can use. Side effect, nervousness, tremor, high blood pressure or hypertension, and develop tachycardia. So before use tarbutaline, we have to check heart rate. Check the pulse before admin and hold if the pulse is over 120. Tarbutaline also can cause restlessness or hyperglycemia. So if your patient have a diabetes, it is important to adjust insulin or oral hypoglycemic agents. Maxalf. Maxalf we use for pregnancy-induced hypertension, or we use for seizure, premature labor, and we can use for antidote if magnesium sulfate toxicity occur. So what are the name of antidote? Calcium gluconate. So what are the side effects? Like if the client may feel hot or flush, headache, dizziness, lethargy, diarrhea, nystagmus, bradycardia, hypotension, nausea, vomiting, vital sign, urinary output, and electrolyte imbalance. Need to check. So side effect for neonate: hypotonia, magnesium level if more than 8 milligram per dl, it is abnormal. Also, we check the patellar reflex in the newborn, right? Met salt injection form. Next, we use erythromycin eye ointment used for prevent chlamydia or gonorrhea in neonate. Another medication, methargine, postpartum hemorrhage. If patient have a bleeding after delivery, we use it. It is contraindicated if patient have pregnancy-induced hypertension. Sometimes it causes headache, nausea, vomiting, hypotension, hypertension, dizziness, diaphoresis. Rubella vaccine given to mother at the time of discharge or teach to avoid pregnancy for 3 months. Rhogram, if Rh negative mother, we give them Rhogm. Also, it is important to know common opioid we use to reduce the pain. Basically, we use Demerol, right? And opioid antagonist is naloxone. So naloxone hydrochloride treat for respiratory depression, and respiratory depression caused by opioid. Another medication, herbal or alternative medication, ginseng, it is good to avoid with pregnancy and lactation. Another question here. A nurse is obtained a prenatal history from a client who has 8 weeks pregnancy to help to determine whether the client is at the risk for a TORCH, torch infection. The nurse should ask about what. So it is very important for NCLEX board. What is TORCH infection? Torch infection. So what nurse should ask? Number one, have you ever had osteomyelitis? Number two, do you have any cat at home? Number three, do you have any birds at home? Number four, have you recently had a rubella vaccination? Correct answer is, do you have any cat at home? Why cat? What are the relation cat with TORCH, torch infection? Let me read the rationale. TORCH, torch refer to T for toxoplasmosis, O for other infection, R for rubella, particularly German measles, C for cytomegalovirus, H stands for herpes simplex virus. So a group of infection or a group of 5 infection together we call torch infection. So toxoplasmosis, other infection, rubella virus, cytomegalovirus, and herpes simplex virus. Agents that may infection the fetus or neonate and causing numerously ill effect. Toxoplasmosis is transmitted to human through contact with the feces of infected cats. Through injection raw meat or through the contact with the raw meat followed by improper hand washing. Osteomyelitis, a serious bone infection. Histoplasmosis, which can be transmitted by birds, and rubella are not related to the TORCH infections. In these pages, showing few common complications, right? Like fetal alcohol syndrome, or we call drug addiction. So if pregnant mother are addicted to alcohol, their baby have to have this problem. So fetal alcohol syndrome is a condition in a child that results from alcohol exposure during the mother's pregnancy. And fetal alcohol syndrome causes the brain damage and growth retardation or problem. The problem caused by the fetal alcohol syndrome vary from child to child. So, hello. So can you hear me? Can you hear me?
Yes, Dr. B.
Okay, okay, okay.